Hi, my name's Sarah and welcome to the Cardiac Ultrasound Department here at Leeds General Infirmary. Your doctor's recommended that you have a stress echocardiogram. This is to look to see if the symptoms you've been experiencing, such as chest pain or shortness of breath, could be due to a blocked or a partially blocked coronary artery. We also perform this test on patients to evaluate valve function and also prior to some surgeries. If you take any medication, it'd be really helpful if you bring a list with you to your appointment. And also, if you please read your letter, because it may say on there to stop any medication 48 hours prior to the test. In the stress echo lab, you'll meet the cardiac sonographer who'll be acquiring the ultrasound images of your heart, and one of our nurses who'll be administering any medications and help record information during your test. You'll be asked to confirm your name and date of birth prior to starting the test, and we'll give you a brief verbal explanation of what you can expect. You'll be asked to remove any clothing from your waist up, and a gown will be provided, which should have the opening at the front. We will then ask you to lie on the couch, and your blood pressure and ECG will be recorded before the test begins. We will ask you to lie on your left-hand side and raise your left arm up above your head. This allows us to get clearer images of your heart using ultrasound. The sonographer will record a set of images while your heart is at rest. Once these images have been recorded, we will decide if a special contrast agent is required. This contrast agent is used to make the ultrasound images clearer. You should not be able to feel anything when the contrast agent is administered. We use this contrast agent on most patients, and it just enables us to see all the heart in much more detail, so we can make a full assessment of how the heart muscle is working. Not everybody will need this contrast agent, and the decision to use it can only be made on the day. We use it in about 80 to 90% of our patients. We will have a discussion with you regarding the contrast agent, and it will only be used if you are happy for us to do so. If we go on to use this contrast agent to enhance the images, a small plastic tube called a cannula will be inserted into your arm, and a very small amount of the contrast agent will be administered by the nurse while the sonographer records the images of your heart. The test can be performed in one of three ways: using a treadmill, using a reclining bike, or using medication. Using the treadmill. This involves walking on a treadmill, the speed and gradient of which will increase every 3 minutes. We will encourage you to push yourself and do as much exercise as you can on the treadmill. The test will be stopped when you feel you can't do any more, or we feel you've reached the necessary level. Our nurse will then give another small amount of the contrast agent, if it was needed, and you'll be asked to quickly lie back on your left side on the couch, and another set of images will be acquired while your heart is beating faster. These are your peak images. Using a medication to increase your heart rate. Sometimes medication is used to increase your heart rate. This will be because you are unable to use a treadmill, or if it's been specifically requested by the doctor. The medication is administered by our nurse through a small plastic tube in your arm called a cannula. The dose of medication will slowly increase at intervals until we get your heart rate to a certain level, or if you request to stop for any reason. During the test, you may be aware of a stronger or faster heart rate, and you may feel a flushed or tingling sensation. This is all completely normal and reassures us that the medication is working. When your heart rate reaches the required rate, which is determined by your age, we will stop the medication and your peak images will be recorded by the sonographer. Another small dose of the contrast agent may be given at this point if required. Using a reclining bike. An alternative method to increase your heart rate is a reclining bike. This is similar to an exercise bike and allows us to obtain images of your heart while you're exercising. The recovery phase. Once the test is finished, you'll be monitored during the recovery phase of the test. Your blood pressure and ECG will be recorded throughout the test and recovery phase. Importantly, we will ask you to tell us how you're feeling throughout the test, particularly if you have any symptoms such as chest pain or breathlessness. Once your heart rate and blood pressure have settled back down to a normal level and any symptoms have passed, we will disconnect you from all the equipment and the test has finished. The test will be analysed and reported by the sonographer on the day, who will compare your heart at rest to images of your heart at peak stress. These results will then be overseen by one of our cardiologists who specialise in cardiac imaging. These results will then be sent to the doctor that referred you for the test. You will not receive your results on the day of your test. We hope this video has been helpful and reassuring. If you have any questions, you will have the opportunity to ask them on the day of the test. You will have the opportunity to provide feedback at the end of the test with our digital screen in reception.